Let's start with foramen ovale. So the structure passing through foramen ovale or mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. Just posterolateral to this foramen is foramen spinosum. Structure passing through is nervus spinosus. So let me explain in detail. This is the triangular fossa called sphenoid fossa. And just posterolateral, the sphenoid fossa is a part of medial pterygoid. Posterolateral to that is foramen ovale. Next comes foramen spinosum. Then spine of sphenoid bone. Between the sphenoid fossa and foramen ovale, there is a foramen called foramen vesalius, otherwise called emissary sphenoidal foramen. Between ovale and spinosum is canaliculus innominatus. This foramen transmits lesser petrosal nerve if it does not pass through foramen ovale. So one of the main structures passing through foramen ovale is mandibular nerve. Once the nerve comes out of foramen ovale, it divides into anterior and posterior division. So from the trunk we have two branches. One of the branch is recurrent meningeal branch. You can see the nerve turns upwards and goes through the foramen spinosum to supply the meninges of brain. Due to its course, it is called recurrent. As it supplies meninges, it is meningeal branch. So recurrent meningeal branch of mandibular nerve passes through foramen spinosum. This is otherwise called nervus spinosus. This is carotid canal which transmits internal carotid artery. Jugular foramen, 9, 10, 11 cranial nerves with internal jugular vein. Stylomastoid foramen, your 7th nerve. That is hypoglossal canal transmits hypoglossal nerve. This is posterior condylar foramen. If it presents, it transmits emissary vein. And you have external occipital crust and external occipital protuberance. So next we can talk about Petrous temporal bone, the inferior surface in detail. You should know Petrous temporal bone contains the middle ear cavity. So the roof and floor of your middle ear cavity will be the Petrous temporal bone. Roof is called tegmen tympani, and now we are talking about the floor of, not the floor, the inferior surface of the Petrous temporal bone. Okay, so that is apex of Petrous temporal bone, which is closely related to foramen lacerum. You can see one muscle attachment at the apex called levator vale palatini, one of the muscles of soft palate. Just behind that we have a canal through which the internal carotid artery passes. That is carotid canal, and behind that we have jugular foramen through which the internal jugular vein passes. And you can see this Petrous temporal bone splits to enclose a long elongated process called styloid process. Okay, this is how it is present, and the norma basalis at the temporal Petrous part of temporal bone. So there is a foramen between styloid and mastoid process called stylomastoid foramen. Just notice here between your carotid canal and jugular foramen there is a small foramen called tympanic canaliculus. As I already told you, the floor of the middle ear cavity is related to the inferior surface of your Petrous temporal bone. Let's see how it is related. See, that is your tympanic cavity, and in the floor we have two canals, one for jugular vein, other for carotid artery. As you all know, there is a plexus around the carotid artery to form the petrosal nerve, joins with your greater petrosal nerve to form median nerve. So between these two canals, the tympanic branch of glossopharyngeal nerve, it forms plexus over the promontory and lesser petrosal nerve is formed. So now hope you understand how it is related to the floor of medullary cavity. You can see within the jugular canal there are few foramina to transmit auricular branch of vagus nerve, and between styloid process and mastoid process, stylomastoid foramen to transmit seventh nerve. Coming to the spine of sphenoid, you should know spine of sphenoid is closely related to your temporomandibular joint. It is just medial to your temporomandibular joint. What is the nerve which is close to the neck of mandible? Auriculotemporal nerve. So that nerve is related lateral to the spine of sphenoid. Medially we have cauda tympani nerve. Just remember these two nerves are related to the spine of sphenoid. In the anterior surface there is a muscle attachment called tensor vale palatini, one of the muscles of soft palate. As I told you, spine of sphenoid is related to TM joint. So here is the mandible, that's mandibular foramen, that is lingula, just above the foramen. You can see there is a ligament attachment from the tip of the spine of sphenoid to the lingula, that is called spinomandibular ligament. Now name all the structures which are related to the spine of sphenoid. Laterally auriculotemporal nerve, medially cauda tympani nerve, muscle at the anterior surface is tensor vale palatini, ligament at the tip is spinomandibular ligament. Coming to foramen magnum, you should know all the 10 structures passing through foramen magnum. Those are occipital condyles on either side. Now we have 3 ligaments. This is cruciform ligament. So upper band of this cruciform ligament passes through the foramen magnum. Then we have a membrane called membrana tectoria. From the second cervical vertebra, that is from your odontoid process, there is a ligament called apical ligament of dens, and that passes through the foramen magnum. So the 3 ligaments are apical ligament of dens, upper band of cruciate ligament, membrana tectoria. What is this? You should not tell spinal cord. This is lower part of medulla oblongata with the covering meninges. It requires vascular supply. So you have anterior spinal artery and posterior spinal artery. You also know fourth part of vertebral artery passes through this foramen. And one nerve is spinal accessory nerve. What is this attachment between your wall of the foramen and medulla oblongata? That is ligamentum denticulatum. That is the first tooth which supports the lower part of medulla. So you have 3 ligaments in lower part of medulla with the covering meninges, and we have 3 arteries, anterior, posterior spinal arteries, and fourth part of vertebral artery, one nerve, that is spinal accessory nerve, and your 10th structure is ligamentum denticulatum. Thank you.